Guys, welcome to my channel. In this video we will cover the topic in vitro fertilization. So it is a procedure where a woman egg or oocyte are fertilized with the sperm outside the body and embryo are placed back into the uterus in order to achieve pregnancy. So the purpose of IVF include blocked fallopian tubes or oviduct, endometriosis, and frequent or absence of ovulation, infertility after other treatment have been unsuccessful, and low sperm count. So additionally, if a man has a very low sperm count and other abnormal semen parameters, it can be recommended IVM, known as the in vitro maturation. So procedure or the steps of the IVF is the ovarian stimulation, then oocyte retrieval, after that fertilization, embryo transfer, and then progesterone supplementation. So the first step is the ovarian stimulation. So at the beginning of the IVF cycle, a woman will generally come in around days 3 before menstrual cycle. So next injection of follicular stimulating hormone, that is FSH, are initiated, and the FSH stimulate the ovaries to produce mature eggs. So LH stimulate the ovaries to produce eggs. So medication to prevent premature ovulation, and in some situation you may even begin medication at the end of the cycle prior to the current IVF cycle. As we know that during pregnancy, the SCG will produce in high amount in the body. So next one is the oocyte retrieval. Approx 36 hours after the receiving the SCG to cause maturation of the oocyte, eggs retrieval will take place. So the next step is the fertilization. An embryologist will examine the collected egg to assess maturity. The mature eggs will combine with the semen obtained from the sperm donor. So the fertilized oocytes are called as embryos. Then embryo transfer. So after the 3 days after the egg retrieval, embryo can be transferred. So the healthiest embryos are chosen for the transfer. Embryo transfer is performed under ultrasound guidance by placing a small catheter or the tube into the uterus and there injecting the embryos through catheter. So next step is the progesterone supplementation. So after the embryo transfer, the progesterone supplementation is initiated. As we know that the progesterone hormones maintains the embryo and development of all other organs of the embryo. The most common are the intramuscular injection. Approximately the 2 weeks after the embryo transfer, a pregnancy test will be performed, and if it is negative, the progesterone supplementation can be stopped, and if the pregnancy test is positive, then the progesterone supplementation will continue for the first to 10 to 12 weeks of the pregnancy. With the help of the Prega kit or the other kit, we can test the pregnancy test. So an ultrasound will also generally be performed within the 3 to 4 weeks of an embryo transfer to assess whether the pregnancy is developing normally or not. The success of pregnancy in vitro fertilization depends on the several factors, including the woman's eggs and the reason for the infertility. The reason which affects the woman pregnancy may be the age factor or the other reasons. So under the 35 years old can range from 35 to 50% per IVF cycle. 40 or older ranges from around 10% per IVF cycle. So risks of IVF may be the multiple of birth, OHSS, ectopic pregnancy. OHSS result from an overstimulation of the ovary and can cause abdominal distension, discomfort, fluid imbalances, severe hospitalization, etc. OHSS means the ovarian hyperstimulation syndrome. It is a type of disease in which the overstimulation of the ovary. So this is all about the IVF, that is in vitro fertilization, and their steps. Thank you.